Hey, good morning. We are in Kinshasa in the DRC right now, and we are over here. We've been here for about 24 hours now. We're meeting with the Ministry of Health, with government officials, and with some of our partners here to be able to do a big humanitarian project in this country. For those of you that are not familiar, the DRC has gone through many years of slavery and racism, and then since the last 20 or 30 years, just many years of conflict and genocide. And it's a really tough area. People have been through a lot here. Also, a lot of extreme poverty. And so we're here doing a humanitarian project, working with a number of different organizations, University of Nebraska, the National Institutes of Health. We're actually doing public health and epidemiology interventions and programs here that are going to help school children. We're going to be providing glasses for school children because it's just something they do not have access to. So we're able to give them prescription glasses, working with Global Vision 2020. And then we're going to track their progress to see if having better visual acuity, being able to see the blackboard and to read a computer and to learn, whether those things over the long term are going to improve their overall education and academic process. And this is the first trip of many that we're hopefully going to be doing over the next couple of years to make all this happen. The people so far have been amazing. They are so generous and just welcoming here, so we really appreciate that. And I just want to keep you guys updated. It's a really unique country, the heart of Africa, some people call it. So we're gonna take you on, and we're gonna show you some of the country and show you what we're doing here. But it's ultimately to make a huge impact, to reach these people and to just love on them. Hey guys, so we just got done doing a day of training here. So we were training local healthcare workers, optometrists, medical workers that are in training. And we're basically training them on how to do low-cost eye care and vision care, and then be able to take that out. So the biggest problem is that access. Everybody has to come to the city if they need glasses. Roughly 98% of the population can't get access to glasses because of that. So we're training them on how can you go out with a small team and start providing eyeglasses for people in need in these remote areas. And so we did a great day of training today, met a lot of people, made a lot of connections. Everybody's really excited about what we're doing here, so that's excited. We can just see the long-term potential here of working and training locals, and then just staying around, just being the mentors for them while they get to go out and they get to be the ones that are doing the change and having the impact in their local communities. And that's what we're trying to do here, is this community-based planning. So it's a grassroots effort from the grounds up, and then it's Congolese helping Congolese solve these problems. So that's what we're trying to do here. Okay, so we made it to the eastern side of the DR Congo after a long day, a crazy flight. We are in Lubumbashi right now, and we're gonna be doing a lot more work here. This is where we're gonna be doing some of our clinics and working with some of our local staff. We're about 5 hours late than we were supposed to be, but we got here, and it was an exciting flight on a local carrier like inside the country, so that was interesting, but we made it. That's the most important part.
Hi guys, we just want to talk a little bit about this UC device because we're always referencing it. So a couple of our friends with Global Vision 2020, they actually invented this device, and they worked with Johns Hopkins University and New England College of Optometry to do the research part of it.
Yeah, and the UC device has been, it's won numerous awards. It's been endorsed by the United Nations, the World Health Organization, and the International Association for the Prevention of Blindness. And Jenny's gonna explain a little bit about how this works and why it's so effective.
Right, so we love it because it works really good when there's language barriers, which we run into a lot. We've been using this in Africa. So yeah, he covers one eye and then he just adjusts the other side until it becomes clear for him. And it's all color-coded with numbers and colors. So it doesn't take a lot of training to learn how to use it, and the numbers and colors coordinate with the lenses, with the actual prescription. So then you just pop the lenses into the glasses, and it's as easy as that.
Yeah, and this device, it's been proven to work for about 92% of people that have standard visual acuity issues. Now, people that have issues like cataracts or glaucoma, or if they have some sort of disease in their eye, those are referred out to an ophthalmologist where they can be treated for those. And typically when we're working overseas, we always try to partner with local ophthalmologists that are working in that area. So then if we do have those people who they fall into that 8% category, we have a place to refer them where they can get the treatment they need. But it works for about 92% of the people around the world. So we are on the eastern side of the DR Congo right now. We met with the kind of the provincial director of education here today and kind of laid out our plans and asked his permission to be able to do our study here, to be able to provide glasses to students. The meeting went really well. I think the director asked some amazing questions on the ethics, the science behind what we're doing, how the information is going to be utilized, and most importantly, that we educate and tell the parents and get the parents' consent for children to be involved in this. And in all these situations, we never want to fall into, like a white savior complex and things like that. And so, we reiterated very importantly that everything that, we're just trainers and advisors and mentors here. Everything we're going to be doing is done by our Congolese staff who understand the culture, who are trained. We've got nurses and doctors and people on our team that have medical training. And I really am glad that we are addressing some of these issues and getting an understanding of how this is going to move forward. And I think it's a thing to say to everybody out there that gets involved in any type of nonprofit, NGO work, humanitarian work, or Christian missions. Whatever that might be, you always want to look at what are the ethics behind what am I doing? Am I doing community-based programming, meaning that we are involving the community from the very beginning, taking the cultural aspects into account and working by, with, and through the locals, because that's really where the empowerment happens. So again, I think there was a great meeting today. We had some really good progress, and we're going to move forward from here. So right now we're at the university here in the eastern part of DR Congo. We're actually going over to meet with the director of the college, and the hope is that we can do some joint ventures with some of their medical students or some of their healthcare workers and make them a part of our study and then work on this jointly, with the possibility too of maybe doing some exchanges into the United States and so forth. So it's exciting. We're gonna go meet with the director, do a presentation on what we're trying to do here, and hopefully we'll have a positive outcome. Okay, so today we are set up at kind of like a courthouse. This is where like all the public defenders here work, and we're putting on finally an eyeglasses clinic, and so people are going to be coming in. It's kind of like almost showing them how this product works, allowing them to see the process and allowing them to participate in seeing this. And so we're going to be providing the glasses today. Our local team here in the DR Congo, they're very experienced at this, so we're going to kind of just sit back and watch and let them take the lead. We're going to see how well they do. It should be a really great showing, and again, doing this with the community. It's being sponsored by the public defenders here for the community, so that kind of idea of community-based development, where it comes from the community and they're providing back to the community, is the whole idea of this. So you're going to see this today, how the glasses work in action, with a local team taking the lead and doing it all. All right, so our clinic's up and running right now. What's happening is basically the patients are coming in, they're getting an initial screening to see, do they need distance or do they need like reading glasses? Do they have cataracts, things like that? So certain things like, cataracts and things, those require surgery. So we can tell those people like, this is a surgical procedure. We're not gonna be able to provide you glasses today. In reality, we can provide glasses that'll give them some, assistance, but we really want to push them for a more advanced ophthalmology procedure to do that. But if a person, comes in and they typically when you hit about the age of 45, you start, your visual acuity starts degrading and you're starting needing reading glasses. So those people right away, we can say, we're probably, if you're in the 45 and up range, you're probably gonna need some sort of reading glasses. And then those that do need the distance glasses, they're gonna go through an entire eye exam. And we're gonna look at their visual acuity and then making them specific distance glasses. And honestly, some people like me, When you start getting up there in age, you need both. If you can't do bifocals, you do one set of glasses for reading, one set of glasses for distance. And so that's what's going on. We also have a nurse present. She's doing blood pressure checks, because blood pressure, things like blood pressure and diabetes can affect the prescription you get. And we're shooting for accuracy on this and getting the most accurate prescriptions as possible. So that's what's going through. The clinic is going on. They're doing a really great job. We're just trying to be here and help and coach and mentor to make this process even more efficient for them. So this is it's a 15-year-old girl. She's the very first girl in the DR Congo that we're testing. It's first child that we're testing in DR Congo. So we're explaining to the staff exactly how you do the training for the children. And then I was just explaining to the children in French the process of how you're going to turn the tester until it's clear. And then when you see it's clear, that's where we want you to stop. And so it's just this is the very first one. She's the very first child in Congo to be able to do this with. So in typical Congolese fashion, we got stopped at a checkpoint. We had our registration was expired, so the car got confiscated. There was a negotiation, and now we are either in detention or getting to the airport. One of the two, we don't know. So here's the update, guys. We all got out safely. Everybody kind of split up once we got to Addis Ababa in Ethiopia. I'm currently in London right now, and we're all pretty much making our way back. Here's the next steps on this. Everything we saw now, we have to compile all this, write it up into a research and a grant proposal, and then start submitting it for grant funding. So the next steps is going to be really putting a construct together, looking for a strong partner that can help us facilitate this, and then submitting and hopefully competing and winning for a grant process. So that's where we're at right now. You know, you can just keep praying for us that you know, this is successful and this is smooth and we can get through this. And some of the loose ends that we saw there, you know, if we can just tighten things up and maybe find a strong academic or a partner on the ground that would be able to help us facilitate this, that would be really great as well. But thank you so much, everybody, for your support, for watching all this, and just for everything. We appreciate it, and we'll see you next time.